6 ways to navigate the current UK healthcare trends that the rapidly evolving world, coupled with the struggle of the NHS to stay afloat amid overwhelming activities, has further emphasized the importance of doctors in our society. Whether you're seeking a doctor near me for an appointment, interested in current medical news like the doctor's strike, or just a fan of the BBC's hit series Doctors, there's much to know and appreciate about the medical profession. 1. Finding a doctor near me in the digital age. One of the most common online searches involves finding healthcare professionals nearby. Simply having a smartphone with a signal and typing doctors near me or doctor surgery near me into a search engine is the first step many people are expected to take, long before they feel unwell or need routine medical care. Websites and apps like NHS Choices, ZocDoc, doctors.org.uk, or even Google offer easy solutions to locate doctors based on specialty, proximity, and catchment area. Convenience is key, and these platforms allow patients to book appointments, access reviews, and even get virtual consultations, making healthcare more accessible. Point 2. Simplified doctor's appointment. Booking a doctor's appointment has come a long way from waiting on hold for hours. Today, platforms like doctors.net.uk streamline this process. Doctors.net offers a patient portal where you can book appointments, receive notifications, and even have follow-up reminders. Online scheduling has significantly reduced no-shows and improved patient satisfaction. However, doctors are obligated to explain their findings to you, unless you are a minor, and they explain in more detail to the accompanying adults. Whether you need a note for work or a specialist referral, most GPs provide these digitally, so there's no need to worry about losing that important slip of paper. You don't have to be stuck with the famous doctor's scribble. These websites/apps will help you in ways you can't imagine. 3. The impact of the doctor's strike. Furthermore, the topic of the doctor's strike has been at the forefront of recent healthcare debates, particularly in the UK, where doctors said they are underpaid for the job they have to undertake daily. Doctors in the UK, especially junior doctors, have staged strikes over pay, working conditions, and government-imposed contracts. As of the latest doctor's strike date, protests have occurred due to dissatisfaction with how the National Health Service, NHS, treats its workers, which raises important questions. Most doctors are already admiring the idea of content creation, so when we give them a reason to make that shift completely to content creation, we will all be left with Google as our doctor. Many healthcare professionals argue that their pay does not reflect their high level of responsibility in the hospital, where doctors are now overwhelmed. Now when they strike, this case gets worse. So do well to ensure your safety in your day-to-day encounters. This is not the time for UK residents to take unnecessary risks, like riding only on one motorbike wheel or trying to see how high you jump. So you have yourself jump over a car in motion, or you sit on the window of the passenger's seat of a car in motion. Accident and emergency units are always full. You need to cut those unnecessary risks in life. 4. Doctors Without Borders, a global perspective. On the global stage, humanitarian organizations like Doctors Without Borders, Médecins Sans Frontières, continue to play a vital role in providing medical care in conflict zones, during natural disasters, and in underserved regions. Doctors Without Borders is well known for its ability to deliver healthcare in extreme environments, often at great personal risk to the medical professionals involved. They serve as a beacon of hope for those without healthcare access while raising awareness about the critical need for medical resources in vulnerable populations worldwide. This means that when a doctor is not treated well in their current location, they are at liberty to pack up and leave, possibly relocate to the region that treats them the best. So please do not lash out at your doctors, who are withstanding pressure from all angles, because they are at liberty to up and leave the entire hospital when it becomes unbearable. Counties in the UK are now trying to keep their doctors and prevent them from leaving. In other words, be kind to your doctors. 4. Doctors in the media. Entertainment meets reality. For many, the word doctor, though fictional, these shows humanize the profession, showing the personal and emotional challenges doctors face daily. Programs like these also spark interest in the profession. Young adults considering medical school often cite TV doctors as an early influence. And while the reality is more paperwork and fewer miraculous recoveries, these portrayals give a nod to the dedication and empathy required to work in healthcare. So don't let the vibes of actor doctors deceive you into thinking that the real-life doctors are enjoying the very same thing. 5. Challenges facing the modern doctor. The role of doctors has always been demanding, but modern challenges have exacerbated the strain. The doctor strike UK highlights some of these concerns, including long hours, limited resources, and lower-than-expected compensation. With doctors working extended shifts to meet patient demand, burnout is becoming a significant issue in the medical community. Though financial concerns like doctors' pay in the UK are central to many disputes, the strain extends beyond money. Doctors are under more pressure to meet patient demand than ever, which impacts their mental health and ability to provide the best care. Strikes are often a last resort to bring attention to the systemic issues that need reform. This means that you are now expected to look after yourself even more than before. Don't overlook symptoms. Go for tests that you have been asked to go for. Exercise and drink water as much as you can to help doctors. 6. The future of healthcare. Moving beyond the strikes. While current healthcare challenges are apparent, the future also looks promising. More medical students are enrolling in universities, inspired by global initiatives like Doctors Without Borders and awareness raised through media. Innovations in healthcare technology will soon reduce the administrative burden on doctors, allowing them more time with patients and improving the quality of care. Some parents or families are very proud when their member becomes a doctor. It used to be much more before, and it is still there. People love it when their family produces a doctor. We also see a shift towards holistic and preventative care, which might eventually reduce the strain on the healthcare system. Doctors are beginning to work more closely with nutritionists, mental health professionals, herbal medicines, and even fitness experts to offer a more well-rounded approach to wellness. This new direction aims to treat the whole person, rather than just the symptoms. Conclusion. Whether you're searching for a doctor near me or are curious about the latest doctor strike date, it's clear that the healthcare profession is experiencing significant changes. And this is not just for the NHS to combat. We all have a part to play, so we don't overwhelm the available doctors in the hospital. Accidents happen every day, but don't take unnecessary risks in the name of fun. I will leave you with this sad truth. Content creators are earning way higher than doctors.